Hi, Dr. Randy Grill, nursing home dentist, talking about my sleepless nights, a case study. This started several years ago when it wasn't safe for me to take out a tooth. Wanted him to go to an oral surgeon, ended up in a general practitioner, and he broke her jaw. Fortunately, with the power of attorney, the POA, we had already warned them that her jaw could break. This dentist did nothing wrong, but in my hands, in a dental office, that wouldn't happen. I would have just taken out the one infected tooth, the one that was hurting her, and not go and take out 9 or 10 other teeth just because they were bad. And this is just part of my training. This is part of my study. I use acronyms like McLaren's and OSCAR, which the American Academy, I've got to read it. The American Academy of Oral Medicine recommends we use OSCAR, which includes in our diagnosis and treating plan things like anticipated age of life. We talked about that in the videos on getting a second opinion and on McLaren's. Those things are critically important. But as in dental practice from 76 to 99, I never had to use those things because I was just lurking on McLaren's 1 and 2. People are living longer in nursing homes or being kept alive longer in nursing homes, and so they're now wandering into private practices. And one of the things that I want to emphasize is my sleepless nights happen about 3 times a year when this happens. Most of the time, the POAs get with me, at least on the phone. I go over my notes, and they're much more cautious, and these horror stories don't happen. Was the dentist wrong? No. It's protocol in dentistry. There's nothing negligence or anything like that. But just because the information isn't out there, it's not the norm in the community, doesn't mean you as the POA should know it, and it's your decision. I made a decision with my mom in her life. She deceased in 6 weeks after my decision to have a hip surgery. And I'm at peace with that. I knew the information, I knew the risks, but right now the risks aren't out there. That's why this video channel, to tell you the truth, is from my sleepless nights. Rather than just worry, be upset, and maybe quit, this is my way of getting that information out there. It's a little bit of information. It takes no study for dentists, but it makes sense once you're involved in it. And you know, in private practice, you only treat McLaren's 1 and 2. You don't use OSCAR. I use SOAP and OSCAR. Most practices use SOAP. In fact, on my notes in the office that are left in the nursing home, it's SOAP. So let's get on to this case study. I first wanted to see the patient, and you'll never know what it's a cold case. And I use that not because she's cold, but just because it's time-wise. She refused first practice and said the first appointment she refused. I have my own dentist. I don't need to see anybody. And the staff said, she's in a mood. You're not going to get anything done today. That mood is very important. And her note on, she has a dentist. I saw her a couple months later, and she said, I never went to a dentist as a child or when I was married, and gave the reasons. My last dentist didn't want to take out this tooth, and that's tooth number 12 because it was broken down. And I agreed with it. It was totally brittle. And I have an article here from Patient Teaching, a Guide to Oral Health for Seniors. It talks about brittle teeth and how they calcify in, and that's why they don't hurt on an older person, and a younger person would be swollen up and hurting. That's what's protected people for years before dentists could even go into nursing homes, is their nerve shrivels and dries up. That way it doesn't abscess, and that's why there's so little heroics care that needs to be done in that area, that you can sit and watch when they've got 24-hour care. Every home has my phone number on 24-hour call. Leave a message, and the number's always up on the right-hand part of my records. So let's go and just read a little bit more on this record. And this is what I had hoped the POA would have done or gotten a hold of me so we could have gone over this. I prefer going to the nursing home and doing a co-discovery and co-exam and actually showing everything, but we can do it on the phone. It works. And then the POA can make the decision. Do I want to do an out-of-network benefit? We've got a good out-of-network benefit if somebody doesn't want to follow my recommendations. But make sure your dentist knows a few things first and ask some questions about how are they going to handle a DNR. If this person has a DNR, do not resuscitate. 83 years old, and we're going on to where she's got 5 crowns. I suspect they're failing, but I can't prove it because I couldn't get x-rays. And her teeth are too brittle to recrown anyway. And then we go down, and she's got severe recession, so the fillings are going to have to be really long if they're to be done. She's not a perioral graft candidate. Her health history, she's got heart problems, Parkinson's, insomnia, CVA, cardiovascular disease. She's on Plavix and Coumadin, which is like a major red flag because you can't keep a person on that very long. It's a crisis medicine management that they will not let you use long term. So I know right there, okay, she's going to bleed like a stuffed pig when I roughen up any of her tissue doing the fillings. That's going to keep the fillings from seeding, and in 6 months to a year, they're going to fall out, and you've done harm. But without all this information, we don't know. We don't know what we don't know. Also, risk of surgery, of removing that tooth, is jaw fracture, stroke, poor painful healing, and more. And in the risk-reward ratio, this person's teeth is non-restorable, and she's better served not doing 15, 20 fillings. You're going to hurt her. You may injure the TMJ. She can't breathe. She's got COPD, so when I couldn't even do a good cleaning on her because she would gasp for air, and you can create a stroke, putting a person at risk without being able to have them freely breathe. So the risk-reward ratio is not there to do normal McLaren's 1 and 2 dentistry on this patient. Be safe. Dr. Randy Grill, the nursing home dentist.